Hello, and welcome to the EMT COVID-19 vaccination training module. I'm Dr. Tim Chismar, State EMS Medical Director at MIEMSS. We have developed this training module to provide a pathway for Maryland EMTs to administer the COVID-19 vaccine under certain conditions. In this training module, we will cover the following objectives to help prepare you for success. We'll discuss requirements for EMTs to administer the COVID-19 vaccine. We'll review the intramuscular medication procedure at the deltoid site. We will review signs and symptoms of acute allergic reaction and anaphylaxis. And finally, we'll discuss common side effects of the COVID-19 vaccines. In order to administer the COVID-19 vaccine, an EMT must meet all the following requirements. The EMT must have completed the MIEMSS didactic vaccination training. EMT must have physically demonstrated intramuscular injection skill competency with approval from the MSOP and medical director. And finally, a physician, nurse practitioner, physician assistant, nurse, or paramedic must directly supervise the EMT in administering the vaccine. There's a maximum of 3 EMTs to 1 supervisor. The vaccines will be prepared and drawn into a syringe for administration. The EMT will be provided with a syringe that has already been attached to a needle which is capped. The EMT will then verify the 7 rights of vaccine administration, use aseptic technique when administering the vaccine, safely administer the vaccine into the deltoid muscle by the intramuscular route, and ensure that the patient receives information on common side effects and signs of allergic reaction. Each patient should receive a fact sheet or vaccine information sheet that discusses this in detail. We will briefly discuss the currently available vaccines. New vaccines may be approved in the near future. Both the Pfizer and Moderna vaccines have been approved under emergency use authorization. Both vaccines work by engaging the body's immune system in a similar way, thus giving the body an ability to create antibodies against a protein on the outside of the virus. Both require thawing and preparation prior to administration. This will be done by the health department or hospital staff. We will not discuss the details of this process. Importantly, neither vaccine contains live virus. Although the vaccines both work through similar mechanism, there are some subtle differences. It is good to be aware of these differences, but not required to commit this information to memory. As you can see, the Pfizer vaccine is approved for ages 16 and older. It is given as 2 doses 3 weeks apart, and the injection is 0.3 mLs per injection. The Moderna vaccine is approved for patients 18 years of age or older, again given as 2 doses, however 4 weeks apart, and each injection is slightly larger at 0.5 mLs. Again, additional vaccines may be approved over time. Let's briefly discuss the contraindications or who should not receive the vaccine. Anyone who has had a severe allergic reaction after a previous dose of this vaccine should not receive a second dose. And anyone who has a severe allergic reaction to any ingredient in the vaccine should not receive it. Each person should receive a vaccine fact sheet ahead of time listing the details of the ingredients contained within the vaccine. Screening should occur ahead of time, but not by the EMT. Prior to administering a vaccination, it is important to check the 7 rights of vaccine administration. As the vaccine will be pre-drawn for you by a supervisor, this will consist of a verification process with the supervisor and patient. These include ensuring the right patient, right medication, in this case the vaccine, right dose, route, and equipment, right site, time, and importantly, right documentation of your procedure. It is important to prepare your equipment ahead of time. These are the items you will need to have at hand when administering the vaccine to each new patient. Gloves should be changed in between patients. All equipment is single use, single patient. Nothing should be reused between patients. A 22 to 25 gauge needle should be used to give the vaccine. The optimal needle length varies based on the patient's gender and weight as shown in the chart. In most cases, a 1 inch to 1.5 inch needle will be appropriate. We want to give the vaccine sufficiently deep at a 90-degree angle to the skin to ensure that we reach the deltoid muscle. During this brief video presentation, we will go over the steps to administer a vaccine by the intramuscular route in the deltoid muscle. You will notice the patient is seated for comfort and all of our equipment is available. The first step is to locate the landmarks to give the deltoid injection. The deltoid muscle is a large muscle that starts at the shoulder and extends to the mid-upper arm. We will first locate the bony corner of the shoulder called the acromion process and find its outermost edge, which is here. We're going to go 2 finger breadths down, and then we are going to bring the fingers from our other hand up to meet, creating an inverted triangle of safety zone for injection. We will aim to give the injection just below the index finger of my left hand. It is important to stay within this triangle to lessen the risk of hitting nerves or blood vessels. Now that we have identified our landmarks, we will take out the alcohol prep pad, open that up. Again, we confirm our landmarks. We will use our alcohol prep pad to clean the site, starting at our injection site and moving outward in circles. We have checked the 7 rights and prepared our vaccine as noted earlier, and we are now ready to give the intramuscular injection. I have pulled the skin taut with my non-dominant hand. I'm gently moving the skin back and forth just prior to administering the injection to help distract the patient and lessen pain. The needle containing the vaccine is inserted at a 90-degree angle with respect to the skin into the deltoid muscle site using the landmarks that we previously identified. Remember the triangle of safety. The plunger of the syringe is depressed, which pushes the vaccine into the muscle. Then the needle and syringe are removed directly backwards at the same 90-degree angle used for insertion. Of note, for intramuscular vaccine administration at this site, aspiration or pulling back on the plunger prior to injecting is not necessary. Place the needle and syringe immediately into the sharps container. Do not attempt to recap the needle prior to placing it in the sharps bin, as this can increase the risk of needle stick injury. A bandage is applied over the area. All people who receive a COVID-19 vaccine under emergency use authorization must be observed and monitored for adverse or allergic reactions. For a person with a history of a severe allergic reaction, please monitor on site for at least 30 minutes. For all others receiving the vaccine, they should be monitored on site for at least 15 minutes. Each vaccination site should have equipment and medications such as epinephrine and diphenhydramine on site to treat patients with potential allergic reactions. The following signs and symptoms raise concern for an allergic reaction. If a patient indicates any of the following signs or symptoms during their observation period, please notify your supervisor as soon as possible. Keep in mind that the signs and symptoms of an allergic reaction may involve the respiratory, gastrointestinal, or cardiovascular system, or symptoms involving the skin. The following is a list of common expected side effects associated with the vaccines. Importantly, these are usually delayed by a few hours. An immediate onset of symptoms within the 15 to 30-minute observation period after the vaccine is given would be more concerning for an adverse or allergic reaction. Allergic and severe adverse events, such as the sudden onset of symptoms or need for medical care after a vaccine is given, require reporting to the Vaccine Adverse Event Reporting System, or VAERS. Please notify your supervisor if a patient reports any adverse event to you while they are on site. The VAERS report should be filed by a supervisor or leadership of the vaccination clinic. Now that you've completed the didactic training, you should take the following next steps to be credentialed as an EMT vaccinator. Demonstrate proficiency with the injection skill with your jurisdictional or commercial service. Apply to be an EMT vaccinator in the licensure system at www.miemsslicense.com. Receive approval from your jurisdictional or commercial service and medical director in the licensure system, and then perform vaccines under direct supervision. Thank you for taking your time to complete this EMT COVID-19 vaccination training. I'm grateful for your dedication to the Maryland EMS system and our patients. Don't forget to wear your mask.